goals of therapy for patients with axial spondyloarthritis, number one is to improve their signs and symptoms. We want to give them better quality of life, and reducing their pain, reducing their stiffness, improving their mobility are some of my important goals, because that's what bothers the patient in day-to-day life and in their work. We have got excellent medication who will do that, and I'll come to that in a minute. The next goal, which is currently aspirational in a way, is to prevent further radiographic damage. We don't have any prospective studies to show that any of the therapies that we do actually stop or reduce rate of progression. We have very strong hints looking at retrospective data, looking at large cohorts of patients that we have followed for many years. What we find is patients who are treated with biologics, especially with tumor necrosis factor inhibitors for long periods of time, have reduced rate of progression. But that's retrospective. To really say there is a cause and effect relationship, we will need prospective studies of long duration, where we see that patients who are receiving these drugs are not only improving their quality of life by reducing signs and symptoms, but also improving the quality of life by reducing radiographic progression. But that currently is aspirational. We are heading there, but we are not there as yet. In day-to-day practice, we do measure the patient's disease activity. There are several methods we can do that. One, the simpler one that I use in my practice is called BASDAI, Bath Ankylosing Spondylitis Disease Activity Index, which is just 6 questions. It's a patient-reported outcome. There is a first question about the fatigue, second question about the neck and back pain, third question about peripheral arthritis, etc., also about morning stiffness. This has been validated. This is what we use in daily practice. This is what is used in even clinical trials. There is a more complicated one, which is called ASDAS, Ankylosing Spondylitis Disease Activity Score. ASDAS is not used in day-to-day practice in the United States. It's a much more complicated formula. It's a newer one. It takes some of the questions from the BASDAI, which I said earlier. It asks about their neck pain and back pain and their morning stiffness. It also asks the patient about their overall assessment of their disease, considering all the ways in which health and disease affects you, how are you doing, kind of stuff. And the additional thing that ASDAS has, which BASDAI does not have, is the C-reactive protein. C-reactive protein is a blood test, and that tells you about the inflammation. So the BASDAI, which we use daily, is criticized because it is purely patient-driven, subjective. ASDAS has some objective measure with the CRP. But the problem with ASDAS is that it has a complicated formula, and you need a calculator to calculate the ASDAS with the formula. It is not as simple as BASDAI, which is very easy to calculate within a few seconds, in fact.